So how long does it take to become a nurse?
For me, it took 4 years. I had a year and a half or 3 semesters of prerequisites, and then I got accepted into the nursing program, and then that was 5 semesters.
Oh, wow.
And that was for my bachelor's of science. I know some programs, depending on where you are, it can take 5 years to get a bachelor's.
Okay. All right. Did it take extra training to work on the transplant unit?
When I got hired, I went to just regular, hospital orientation. Then when I got onto my floor, I learned some extra things, but it was pretty much on-the-job training. So there were certain things that in transplant we do that other floors don't do, but you kind of got to learn that as you did what you call your sort of preceptorship, where you have a more experienced nurse training you. And I learned those things sort of while I was working, but she was overseeing me.
Oh, okay.
And that was over about a month or 2.
Okay. Where did you go to school to get your BSN?
I went to South Dakota State University. I'm from South Dakota, so it was one of the better nursing programs in our state.
Okay. What degrees are required to practice?
Technically to be a nurse, you can have your LPN, you can have just your RN, but I think the norm now is at KU, the hospital where I work, they pretty much are requiring all nurses to have a bachelor's. So it used to be where you could have a 2 or 3 year degree, but I think the way most hospitals are going is that they are going the bachelor's route, where they only hire you with a bachelor's. And so you don't have to have a bachelor's to be a nurse, but a lot of hospitals are requiring a bachelor's now.
Okay. And about how many patients do you think you see every day?
I'll help multiple patients a day, but if I come to work and I have an assignment those are my patients, 4 is usually how many we have. That's the most that we can have on our floor. We're called a progressive care unit, which is in between an ICU and a med-surg unit. On a med-surg you can have 5 or 6, but on our unit you can only have 4 patients that are your patients. Mm-hmm. And so those are my 4 patients. If you want to call the ICU those 4 patients, but of course throughout a day I see a lot of different patients because I'll help other nurses and answer call lights and that kind of thing. So our unit has 27 patients. I wouldn't see all those, but I'd see, maybe 10 to 15 during a shift.
Okay. And what's the most rewarding and most difficult aspects of your job?
It's probably very similar. The most rewarding and the most difficult is that we're helping people during a time when they really need it. And so, to me, I feel like I wouldn't want to do a job where I wouldn't know I'm making a difference. And I know every day that I go to work, I'm making a difference because I'm, whatever it is, even if it's something simple like helping a patient to the bathroom, I think we're caring about those people while we do those things.
Yeah.
And so that's the most rewarding, just knowing that I'm helping someone in a time when they're really, kind of vulnerable and need it. But then that can also be the challenging part, is that people, respond differently to being in pain or being sick. And so you get to, of course, as a nurse, when you see people who are dying, that's always super challenging, and to know how to handle that, and you feel just really sad. So sometimes if I have patients who have been diagnosed with cancer recently or whatever, I work on the transplant unit, but we get a lot of patients that have other things going on. Mm-hmm. So those are the hard parts, when you have to see someone who, just got a bad diagnosis, or you just know for sure that they're not probably going to make it. That's really challenging.
Yeah, that's sad.
Yeah, it's not easy, but at the same time, I think it's a cool thing to be able to be there with people during those times.
Okay, well, I think that's all I have.
Okay.
Thank you.
Yeah, no problem. Happy to help you out. So you have to write a little PowerPoint report type thing?
With your name and all the answers to the questions and stuff.
Okay, cool.
Yeah.
Good deal.
Thank you.
Is someone going to interview your dad?
Probably not.
You could give someone else your dad.
Yeah, I could.
How's your dad liking his job these days?
He's really busy because he's like doing school at the same time.
I know, yeah.
But I mean, I think he likes it okay.